Routine solutions aren't effective. They're looking for something different.
就是这样子，然后他就把这
And
原
sometimes
理
there
是
isn't.
平
To
常
your
的
point
方法
earlier,
没有
sometimes
用
there， isn't
他是
something.
要看其他的方
Assisting
法。
patients and families understand what's available.
就是
Clarifying needs and goals and wishes. And I find particularly around things like what you mentioned before, end of
这
life
边有
issues.
引爆很多家人呀，
How
他们
aggressive they
他
want
们
to
的
be
目
in
标是怎么
treatment
样，
for
他们
oncology
想法是怎么样。
problems. And then I think the other thing that case managers do is they help the multidisciplinary team understand the available options and how they relate to what the patient and family want.
multi 是多科
We
，multi 是
sometimes,
多了，
in the United States, and
discipline
it might
其
be
实
different in Taiwan,
规矩。
we
地方
sometimes
你好
move
像
ahead
去
with
discipline the
things
kid， 你就
that
是
we want.
教育你的孩子
But the，patient
把他
and the
把
patient
I don't know put
family
it together
don't want. And case managers need to listen out to that. Who is the case manager, or
Okay,
the
yeah.
case manager's role? The primary difference between what case managers do and what a staff nurse does, or between what a case manager does and a staff social worker does, it has to do with intensity of interventions. They use the same process, but their interventions are more
他是不
intense.
同讲，我
They
我
also
这是
have
问题
more focus and, believe it or not, availability of
是
time.
这边吗？
I'm sure the case managers are saying, I don't have time, but you have a different kind of time than staff who are
physicians 医生
really locked into medications and all that kind of thing. Case managers, whether they're nurses or social workers, tend to look at the continuum. You're looking out. They're looking at the
social
whole
worker 通常是长
rest
远
of
一
that
点，
person's life and trying to make sure that we've got things in alignment for that. And they're also, staff focus on clinical, case managers focus on clinical and financial. So those are the big differences. Case managers also
你在录
work
吗？
in a network. And networks are unique to the patient population. So your network for oncology patients will be different than the network for cardiac patients. Will be different for the network for orthopedic patients. So what is in a network? You've
在那个
got
网里面
resources and services that are needed often by a patient and the patient's family. So, if you've got a specialty caseload like cardiac or oncology, it's going to be more stable and more consistent than caseloads that have a more general practice. And one of the big things that case managers do is nurture that network. They create it and they nurture it. And as an example, when Paula and I were at the New England Medical Center, we had a child psychiatry unit. And
心理医生，
that was one of
小孩子的心理医
the
生
units I've ever been on in my
小孩子的
life.
心理
But we had a social worker in a case management role, and we had a lot of children that we had to get custody for. So their parents could no longer be legally responsible for them. The court system had to assume responsibility. And that social worker developed such a strong network with the court clerk, not the judge, but the clerk, because that clerk was the person who would give them access to the judge. So that woman could, if we had a patient that we needed to get a fast custody hearing for, could virtually pick up the phone and within 5 minutes have a custody hearing scheduled.
它主要是从美国的法庭，他那个 social worker 那个 case manager 也知道怎么去拿资料。他不直接跟那个法庭那个 clerk， 不是那个法官，他应该有什么行径去做的结果。他主要是这样讲 social worker 是要重视有结果。
She would call them and see how things were going. What could we do to make her life easier? That was nurturing the network. And what did it get? The patients and the hospital, it got rapid response. There was not a call that she made that didn't get responded to. So here's a sample network. And this is a patient, just a general network. And then I'm going to ask some of you to think about who you would put into this. In oncology, you might have hospice. You might also have hospice in congestive failure. Disease-related agencies. There's an Alzheimer's Association. There's also the American Cancer Society, which provides amazing services. The American Heart Association does a lot with strokes and heart attacks. Community agencies. Who's out there that can provide support? Are there senior centers, area agencies on aging that can help? The pharmacy. I don't know if it's true in Taiwan, but in the United States, sometimes when we send patients, particularly pediatric patients, to remote or rural areas, you have to make sure that the pharmacy in that area carries the drugs in the dose that you need that patient to go home with. Physicians, of course, social agencies, legal services. Does the patient have a will? Does this end-of-life patient have a will? Do they have they stated for us in the States their durable power of attorney? Do we know who, if they become incapacitated, who they have designated to manage their care? Religious organizations. Do you have parish nursing in Chicago? Yes. That's
religion, 信仰，
wonderful resource.
宗教信仰，对。
It's amazing. Anybody here a parish nurse?
组织，宗教组织。
A parish nurse is a nurse in a congregation of a church, and they basically provide nursing care to the members of that congregation, and it's a wonderful resource. Government agencies. Sometimes you have to tap into government agencies to do what you've got to do. The therapies. I have just have up here physical therapy, occupational therapy, but it could be speech therapy, it could be all other kinds of therapy. Payers. Sometimes you have to make a deal with payers that is different. Meal services, Meals on Wheels. Although I think now Meals on Wheels is getting punched with the gas prices, from what I've heard. Home health. You got to be in this. And then I started with hospitals. So I want you to think. For a diagnosis that you have, who would be in your network? Yes.
One thing that I think that I find increasingly, and I think most of us have, is I have patients who come to me with information off the internet.
Yes.
And that has a tremendous impact in almost all of those areas.
影响很大。
Sometimes the information if they bring off the
他
internet is
把
useful,
这
and
资料在网
sometimes
上
it's
download
bogus.
下来拿给他，他说影响很大的。然后
And so I would add to that a list of responsible
Internet resources. I agree with you. That's a great idea. Yeah, something that you can really say to the patient, this information is valid.
Right.
Excellent.
Peer reviewed.
Peer reviewed. Yeah. Yeah.
I would add to the network former patients or families.
Oh, great idea.
Because sometimes things
以前的病人
communicate
former
better with
patient.
families or patients with a new diagnosis because they know where they've lived through that experience already.
他已经
Well,
经
it's
过。
interesting you say that. I've been working with a cancer organization, and they have a program where cancer patients who have finished their treatment come and visit newly diagnosed patients. And I've had the opportunity to talk to some of these, and they were all women that I was talking to, that said they wished they had had the information before. Because it was simple stuff, like when it said small meals, this one woman had a small steak and a baked potato right after she had had a partial gastrectomy, and then was throwing up. And she said it would have been useful to have had somebody say, you don't want to do that. Or a friend of mine who had chemotherapy for breast cancer, I talked to her the night of her first treatment. I said, how are you doing? And she said, fine. I said, did you take the anti-nausea medication? No, I'm feeling great.
Anti-nausea.
What did you have for lunch?
让他不
Dinner?
吐的药。
Pea soup.
嗯。
What do you think?
你都明白他讲吧？
Not a good.
No.
It didn't last. So you're absolutely right. Those patients and families who have been through
以
it
前生病过的，
have
再
an
去跟那
important
新
role to
生病
play.
的人
Yes.
会很有帮助，因为他已经历过。
actually engaged an
可能刚才他说叫是病友吗？
here in Illinois, and I had them come to our stroke screening here at Loyola, and it was really, I actually got a very nice
Really
letter
your
from the
idea.
lady that was one of the stroke survivors. She really felt that it helped her just as much as she helped other
Yeah.
people. So, and they actually came and spoke to my last stroke support group, and it was, the dialogue was
这
really
边美国有 support group，
So bringing
尤其是
bringing
环
patients
境
who have
病
been
人
through a，
每个
treatment
病人都
process
组在一起讨论啊，讲有什么，这边是 support group。
有时候病也会的， One of the gentlemen was really having a hard time getting disability, and he's a young man who's a truck driver who now cannot work. And so this guy was like, oh, hey, wait a sec, can we need a little iPad and, got an
他只是
Yeah,
说，
it's
只
amazing
是举例
what，
他说
knowledge you
刚
can
刚
tap
跟
into.
提起来。
Other things that you would put up on this list. What I'm going to ask you folks to do is sometime around break, I'd like you to think about who would be in your network.
这个就
This
是
is our
所有
network.
他们美国的，就是他
So
们是一
take
个网站。
an
台
oncology
湾呢
patient，
台湾
or
你
a
们
heart patient
你们
and
是
say
会
who
哪一个
would
人
you put in your network?
在会一个 case 哪一个人会里面都是要
Questions? Thoughts? Okay. Okay, here we go. I'm going to stop talking about case management because you're going to hear from some folks who are doing case management. I also want to take questions and thoughts. One thing, it just occurred to me, we didn't talk about how many patients a case manager case manages.
一个人可以管多少个病，没有讲。
And the
看
answer
看
is
他们。
yes. Let me ask the case managers who are here. How many patients do you typically have in your caseload?
Well, I have 12 medicine services that I follow, and those patients I look at on a pretty much daily basis, and I'm looking for my readmissions, my high-risk patients, my patients that I know need teaching. I look at my patients and their blood glucose and whether or not I need to contact a physician to improve that. I pretty much look to see if someone might be a new diabetic, kind of being proactive and waiting for the physician to call me, because then he's calling me when the patient's ready to leave in 2 hours, and there's a lot that needs to be done. So I do like an Excel spreadsheet. So I would say in a month's time, it could be about
他用电脑
65
帮他了，
people
他有个
that I
spreadsheet。
that I have been involved in, whether it be peripherally or directly, is kind of like, you know, the overseer.
Okay.
And I have one medical ICU.
Okay. That keeps you busy?
Yeah.
Okay.
哇，这样子就
What
比
about you, Amanda?
12个而已，
So
他
a
有
50-bed neonatal unit, so there's usually about 35 to 40 inpatients, and then with our home care team, about 20 to 25 patients who are at home.
我那个突然说还有patient at home 在家里哦，哇，他照顾很多。我这边也有，这边有这么多在家里，孩子又回家了，也有25个。
That's about what I've heard.
Wow.
And you're not doing utilization management.
Utilization, I have worked with utilization,
Right.
we've worked together on some.
But you're not reviewing the charts and calling the insurance companies?
No.
No, if they get stuck, they'll call me, but we work together.
Yeah, really, it's, yeah.
Okay.
And we have a periodic meeting, is it now every other week or is it still every week?
Every other week.
Every other
开
week
会，
where
他
we
们也开
review
会。
cases that have had extended length of stay or high resource
Costs.
utilization. And we talk about what resources do we need to get together
需
to
要什
help
么
make sure that we have
资
the
料啊
appropriate，
他们
plan of
开
care.
会讨论需要什么。
That's where we do a lot of out-of-the-box thinking.
Again.
So what we find in organizations where the case manager is doing utilization review, which is very
我
specific
不知道怎么样。
function in the United
utilization
States,
review。
with care coordination and discharge planning, is in an organization like this, I would say the caseload would be somewhere between one case manager for every 15 to 18 patients.
一个人照顾
Without
15个
supervision
18个
management,
15到
with varying levels of intensity.
不同
My
需要，有
experience
些
has been that
不
it's
是很
somewhere
多
around
能够需要，现在很多需要。
125, 30, somewhere in there, and
With the total of admissions.
With
we-
the- yeah.
看
And then in the community, one case manager, well, what they're seeing in Singapore is one case manager can manage around 25 to 30 patients,
在新加坡
but it very much depends on how intense those patients are.
就
So
看看
if
他
there's
们
the
都
most intense
都
period
重都
with
严重了
patients。in case management tends to be at the beginning.
开始的时候可能
When you're talking,
严重一
are you
点。
talking about a single case manager, or are you
Yes.
talking about a case management team that would be nursing and social work?
Interesting
是
question.
一个人呢，还是一个 team 一个
Probably
队
the？team.
Okay.
Probably the team.
一队
It just depends.
team 是一
You know,
队。
sometimes the ratios will differ, but it's probably the team because they really do have to work together. So that gives you a sense of one case manager
一个人
can
可
probably
以
25,
25个到30
and then you've
个
got some that
病
you're
人。
just kind of keeping your eyes out for
有一些
that
只
you're
是
not really
很
taking
轻
care
的，
of.
只是很轻的，就
But
是
you're listening for
一个月看起来他
And
也是
remember,
很
not
轻
every patient is going to be case managed, am I right?
在讲
Okay.
不是每个病人都需要
So
case
it's going to be a
manager。
subset. I know we're going to have a panel. Anything else that you think that we should bring up about case management?
One thing, at least in my area,
Good.
is that, the medicine area, is as a case manager and as a nurse, I'm the clinical resource
Yes.
for the nurses.
Yes.
So it might not be the patient that I'm directly involved in, but the nurse comes to me and we work out the issues and make suggestions and do
他也
contact.
帮忙护
So
士
you're
的，
kind of doing secondary case management on those patients.
On
他
those
不单只帮助病人，也
And
帮
that's
助
time
护士，
consuming.
护
I'm not
士也问他问
belittling
题
that in，
因
any
为
way,
他本
shape,
身
or
是护
form.
士。
That can take a lot of time.
所以你们的 case manager 也是。
Other things that you think we should talk about for case management? Okay, I want to look at one thing. Let me finish up with you, and we're actually a little ahead of
我开始教过病人，
That's all right. You know, we can do some other things. Don't
其他
worry.
病人，他没有讲到说 case manager 其实
Let's look at evaluation of effectiveness.
他说美国大概一个人教过几个，新加坡是一样。
I'm going to ask those of you who are in patient care management to think about what you use as metrics to evaluate what you're doing. If you're going to look at evaluating the effectiveness of case management and other patient care management strategies, you do have to do it early in the process. And it comes back to goals. Okay, so a question that I'm going to put to our guests from Taiwan between now and the break is, what are the goals of case management?
你们觉得 case manager 的目的是怎么样？
What are the goals here for patient care management? And
目
how do
的
you know that it's working? There's a lot of reasons to look at data. One is to assess the results. Another is to say, is this change we've made working?
结果。
A third one is to say, this is a realistic target or it's not. Pride. I can tell you that I've been working with a group one of whose goals was
30个人，
to
一个人
manage
带
length of
30个病人
stay.
是不是实际呢？
And so they now have a chart in their office, and it shows week by week where the length of stay is to the target. And guess what? They're below the target. They're awesome.
You know, one thing I found with some of that, especially when you're working with, you go to meetings and people will say, oh, that never happens, or that always happens. And then you show them a chart, and they see that it's actually the always is really 30%, and the never is, 52.
Right.
So when you can get some of that concrete data and pop it into a bar or a pie chart or whatever it is, it really adds some weight to the always and the never. And then you get some buy-in into whatever your plan might be, your thoughts might be.
Well, it does teach you that never is almost never, never.
Yes. 永远不会，不是永远不会， never
The other thing about data is it needs to be used. And it
Data
needs to
知道
be
啊，
part
资
of
料
a
资料
decision
data 的
support.
资料，
So you
要
go
用
from
的
practice, and you may have a question.
实
What is a better way to do something? And then you collect the data, you display it, it becomes information, and then you get decisions, which is kind of where you're saying. You come over here and you see that the data
决定 decision 决
isn't
定。
what you intuitively thought it was, and we've got to look at what are some of the decisions that we're making based on the data, and then we've got to educate, and it comes back into practice. So it's a continuous process. But what I'm going to show you is a value compass. And a value compass is a kind of data dashboard. And what it lets you do is look at different facets of data, different dimensions, all at the same time. Do you want to do a data dashboard here?
We have a quality dashboard.
Yeah, that's what I'm talking about.
那前面 放出来
So
看
it will
，display 放出来
put
看。
you in better position to do data analysis. You put the data in categories. And then when I show you this, just know that you can do a data dashboard at the individual patient level. So for example, Dartmouth Hitchcock Medical Center in Vermont, New Hampshire. And I live in New Hampshire, so I know. Where is my brain?
行动
In their
to make it happen.
I think it's a back pain clinic. They give patients an individual data dashboard to show them where they are and where they're going. Okay, so here's what we've got. This is just a sample. We've got operations. So what's the average caseload for nurses and social workers in the practice? And for us, do you all do ED diversion?
Yes.
Okay. How much time are you on ED diversion would be another operations issue. And then for the United States, this is very specific to the U.S., case mix index. Navigation is pretty high.
Yes.
Yeah. Okay. Clinical. How many unplanned readmissions within 15 and 30 days do you experience?
It means specifically, okay.
Now, let me also mention readmission sensitive case types. What would some of those be?
Liver failure.
Hmm?
Liver failure.
Liver failure, absolutely. What else? Cancer.
在这边不是你拿开刀只是操作
CHF.
是操作，那怎么做？
Those are the patients that we need to do disease management for.
有多少人呢？
Because
多
they
少
have
个？
high levels
多
of
少
readmissions.
哦，
Unplanned emergency department readmissions. You discharge a patient from the ED, they come back. Discharge disposition profile. This is again probably something that's more sensitive to the United States. We look at what patients are going home with services, rehabilitation, hospice, a skilled nursing facility, and LTAC, long-term acute care. And what we look for is 40% or more. So 40% or more of your patients should be getting some kind of post-acute services. Now that's a country-specific kind of thing. It's also, I'm saying that, I'm guessing you have a high Medicare population.
35%.
Not so bad. Medicaid?
政府保助的 Medicaid 它的意思也是美国的，政府保助的病人。
Okay. And then, what outcomes are you getting on specific case types? So, for your stroke patients, we talked about those outcomes before. For your neonates, are you getting to the outcomes that you want to within the time frame? Financial. I'm going to leave avoidable day for right now. Length of stay.
可以住院多久？那个 stay 可以住院多久
All your patients in the U.S., I also look at what's length of stay for your Medicare patients. That often drives
Medicaid
your
是政
overall
府
length
保
of
助
stay.
的不同的，
What is your cost to reimbursement per case? So how much
你
does
可以
it
拿到
cost
多
you
少
to
钱
take care of
？Cost and reimbursement 这是可以
each
拿的。
patient? And you may, I don't know if you can get this in Taiwan. This may not be available to you. How much
病人
resources
收
are
钱
you
收
using
钱方面
per case?
cost reimbursement，
For oncology, for
这是你
example.
worry 的。
How much are you spending on drugs? How much are you spending on bed days? How much are you spending
钱方面
on tests and procedures? How many denials do you have? Again, U.S. And then satisfaction. Patient satisfaction with whether or not they felt ready for discharge.
Satisfaction.
Who's your survey?
We're doing the HCAS, we're doing it through press ganging.
Okay. They don't have really good questions about case management in these, unfortunately. And so sometimes we talk about to what extent did the patient feel ready for discharge? What kind of instructions did they get about care at home did they get? And what kind of help did they have arranging home services? So those are some of the questions that you would look at.
I would agree with you, Kathy. Those questions are difficult
Yeah.
because the speed of discharge process for us is the transport. And
Yes.
that's how patients measure it.
Yeah, I don't know, I think we probably come up with something better for case management related issues. Okay. I'm going to do a summary, and then I'm going to put you all to work. Or do you need cookies before you work? So I do see cookies out there. You've taken very good care of us. At the end of the day, the bottom of all of this, the core, is how you coordinate care. And I'm going to go back and say, care coordination is making sure that the patients get the right care at the right time, in the right place, at the right cost, with the right outcomes. Because that will let you get to clinical, financial satisfaction and compliance goals. You have to have strategies to address the care coordination needs of the individual patients as well as the populations. And you have to make sure that as you move patients from one place to another, that the information and the plan about that patient goes forward. Having said all that, questions before I give you, she's uncovering the cookies. We might do that before we...